Good evening. My name is Randall McShepard, and I am a member of the public that serves with many other wonderful members of the public to do our share to move the county transition process forward. I serve as the chairman of the Public Engagement Committee, which is charged with ensuring that as many members of the public as possible are informed about county transition and have the opportunity to ask questions of those that are heading up various committees. We do have someone here tonight to talk about human services, and I'll introduce him in a moment. But I did want to first of all ask those members of the Public Engagement Committee that are here to please stand and be recognized for all your efforts. Thank you very much. We have a couple standing in the back as well. A few housekeeping items directly behind you. To my right, I guess your left, is the women's restroom, and the other end of the room would be the men's restroom. We do want you to take the time to complete the surveys. We want a feedback survey, and there are boxes in the back, a white box and a purple box that are being held up by Gary right now, that we would ask you to drop those exit surveys in. It's very important for us to learn how we can improve questions that you may have that weren't answered so we can do better next time. So please take a copy of that document and fill it out before you leave. There are index cards that are available. We certainly will have a question and answer session. Not everyone is comfortable stepping up to a microphone to ask questions, so if that's the case, Mr. Shane will be picking up cards later, and I'd be happy to read those questions on your behalf. Also, I'd be remiss if I didn't mention that we have voter registration and a Board of Elections here with all sorts of good information about county reform and about registering to vote and those kinds of things. So with that, I guess I will ask Adam to, oh, he's already done it. You see the agenda for tonight. I will be actually very brief. Want to talk a little bit about the purpose of the public forums as the Public Engagement Committee sees it, and we'll then move right into the human services presentation, and I'll then come back and facilitate the discussion and Q&A. So, next slide, please. We do like to remind the public and remind ourselves that this truly is one of the grandest civic education projects of our lifetime. It's 200 years or so we've never reformed county government. So it really is a big deal that we are all a part of this. As a member of the audience, as a citizen, as a committee member, what have you, it's really, we think, a very important and exciting opportunity for all of us to say we were there and we were a part of it. The final slide for me is, what is the purpose? What do we hope to accomplish by way of, hosting these kinds of events? The first one is we want to educate the community on the status of the transition process. People certainly stop me on the street and say, where are we? What's going on? Who's doing what? Where are the committees, et cetera? So this provides the opportunity for committees to present and to answer your questions. Which is the second bullet, but not only to entertain questions, but we want to hear comments. And this is being videotaped, and individuals that can't be here with us today, we hope will tune in soon and watch this at home and hear some of the comments and suggestions that you all will share with us. And then the third point is that we want to take those recommendations back. It's not just the Public Engagement Committee listening to what you all will share with us tonight, but we'll take your feedback back to the work group. So in Rick's case, he'll hear some good questions or comments, and he'll be sure to take that back to his human services work group as they continue to fine-tune and vet, whatever documents they're going to prepare to be handed over. So I did want you all on the next slide to see that we have scheduled several more public forums, and a few more will be scheduled actually. But we would certainly encourage you to mark your calendars. Probably in the next week or so, we will know exactly which committees will be presenting at each of these, and that has been somewhat challenging, and I do want to let you all know that perhaps you saw or heard somewhere that there were supposed to be two committees presenting today, and for a number of reasons, there will just be the Human Services Committee presenting. We, after talking about this, realized they probably could take a whole session just talking about human services at work. But we are confirmed for Brecksville Community Center in about 3 weeks, and then the Beck Center, Corporate College, and the Stokes Library are tentative, although we think those will be confirmed very quickly. And then also confirmed for the Westlake Library in August. We are in the process of also planning a separate Hispanic forum in the heart of the Hispanic community in Cleveland, which will include Spanish interpreters, Spanish-speaking interpreters. And we were in a city club forum this week where someone suggested that we not forget the urban core of Cuyahoga County, in particular East Cleveland. We agreed on the spot to do a separate forum in East Cleveland, and certainly would be open to talking perhaps to some city council reps about doing something similar in a couple of neighborhoods. I did make the point, though, that we are not necessarily trying to set up forums of this size in every neighborhood. That's why we have a speakers bureau, and many of the members of the committee and others are willing to go to neighborhoods and answer questions and speak to smaller groups. So that's another way that we will ensure that the word gets out. But I'll be back later to facilitate the Q&A, but at this time I would like to ask Rick Warner, who has been a fine staff member at Cuyahoga County for as long as I can remember. I don't know how old you are, Rick, but I'm a younger guy, so it's just been a few years, but no, but Rick is one of the co-chairs of the Human Services Committee and has a very interesting presentation to share with you. So take it away, Rick. Thanks.
My name is Rick Warner. I work in the County Office of Health and Human Services, and I appreciate the opportunity to be here tonight to update the community and the folks who might be viewing this later on the Health and Human Services transition process. I want to thank Randy McShepard as the chair of the Public Engagement Committee, also Mary Denahan, who helped me think through what we needed to say tonight, and also my colleague in the Office of Health and Human Services, Mary Louise Madigan. We wanted to sort of update you on a couple things tonight. One is sort of the existing county human services department and how it's structured, where its funding comes from, and some general service numbers, so you have a sense of the reach of the human services world across Cuyahoga County. And then we wanted to talk specifically about the transition work that has started within the Human Services Transition Planning Group. I draw your attention first to the language that's actually in the charter that folks voted on last November as part of issue 6. This is the paragraph on human services. So just to put into context the fact that I think human services represents, depending on if you look at local or all resources, anywhere between 45% and 60% of the county budget. It is represented by a relatively small portion of the actual charter. I think that's in part because many of the charter provisions went to the amalgamation of functions that were previously or are currently held by other elected officials, and the human services work will continue in the county we'll have the same mandates and responsibilities that we've had historically. If you go over to the next slide, and I think there were copies of the handout in the back. If you don't have one, I understand if it's not already posted on the transition website, it will be tomorrow morning, so you can download it. There are some slides that are particularly small type, and so you'll want to make sure that you take a look at it on the computer. Just a couple things about the way that the County Human Services Department is organized and what our responsibilities are. We are essentially, for human services purposes, a creature of the state. We deliver services to residents in Cuyahoga County, but much of the funding, the rules and regulations, and the mandates on us come from either federal law to the states and then state law to us, or directly from the states to us. You can see that we have mandates in a number of areas like child welfare, adult protective services, public assistance benefits, as well as child support. And so those, again, The county really has no choice about whether to do those, to provide those services. We are required to by the state and federal government. In return for us doing that, we get resources from the feds and the state, and that is anchored by $240 million of local money that's raised through the Health and Human Service levies, one of which was just passed actually at the beginning of May, issue 15. We appreciate all the support in the community and across the county for the Health and Human Service levy. Those two levies together generate annually $240 million a year. That leverages about another $400 to $500 million of federal funding that flows down to the county for the provision of health and human services. I also wanted to note that in the Ohio Revised Code, there's a section that specifically refers to large counties and allows large counties, those over 500,000 in population, to establish their departments of job and family services in a way that's slightly different from other counties, and I'll get back to that in just a second. And for those of you who are very aware of state human services lingo, we are a triple combined agency, which means that in addition to the job and family services functions inside the human services work at the county, we also have the Public Child Services Agency, which is our Department of Children and Family Services, and the Cuyahoga Support Enforcement Agency, which is the Child Support Agency. So that's our structure, and we're allowed to be structured in the way we are thanks to state law. If we go over to the next slide, you'll see the current structure, and I apologize for the size of it. Hopefully most of you do have the handouts. You can see at the top right now, we have the county commissioners, who are the 3 elected county officials who oversee us. There's the county administrator, Jim McCafferty, and then there's my position, the deputy county administrator for health and human services. You'll see on the left side in the light green, those are the mandated departments that the state says, or mandated services that the state says we must provide, and they are provided by the departments that you see there, and we'll go into a little bit more detail about those in a minute. The ones in the light and the purple on the right-hand side are non-mandated functions, but to the minds of the county commissioners and those of us who work in the Human Services Department, the areas represented on the right-hand side are fully as important as the mandated services that we provide, but those are decisions that we've made locally, we believe, based on community interest and advocacy. Going over to the next page, and I'll just keep us there for a second, I just wanted this to illustrate that in the Office of Health and Human Services that Mary Louise and I are on, there are a number of things that we do that don't fall neatly into any of the categories that we saw on the previous slide. So there are responsibilities for Ryan White, which is the AIDS and people living with HIV programs that we get funding from the federal and state government. You have the health and human service levies, and great credit has to go to Mary Louise Madigan for organizing those campaigns every other year to pass the health and human service levy. And then we also do a lot of work with the other public health and human service systems. The Alcohol and Drug and Mental Health Services Board, we have a great connection with and do a lot of work with. The commissioners appoint, and the new government will appoint a majority of the board members of the Adams Board. We work very closely with the Board of Developmental Disabilities. We work closely with the Juvenile Court. And so there are a number of organizations that are also public institutions but aren't controlled directly by the county commissioners, will not be controlled directly by the new county government, that work very closely with the county in providing health and social services. The next couple of pages indicate just some numbers, and I tried to pull out sort of representative statistics that might be useful for you in thinking about how we're organized and what kind of services we provide. And I apologize for the acronyms or the abbreviations, but the first department is the Department of Children and Family Services, which provides child welfare services. It has 857 employees, which is down from almost 1,100 employees just a couple of years ago. We currently have 1,687 children in custody, and in 2009, just as a point of reference, we had almost 20,000 calls that were intake calls to the 696 Kids, the Child Abuse and Neglect Hotline. The budget for the Department of Children and Family Services is $153 million, and that's again made up of both local dollars and federal and state revenue. The next department is the Department of Employment and Family Services. It is what used to be called the Welfare Department. It's the public assistance agency for the county. It has 724 staff, and if this begins to sound a little bit like a broken record, it is. We've seen a tremendous downsizing in our staff over the last couple of years, and so the Department of Employment and Family Services a year or so ago had close to 1,000 people. So we've seen a great reduction in staff, primarily as a result of an early retirement program that the county sponsored in 2008 and 2009. The Department of Employment and Family Services has 135,000, give or take, cases. Those represent families and individuals that they provide service to. They provide food stamps, Medicaid, child care vouchers, pardon me, and a Healthy Start, and other support services. Just as another point of reference, 275,000 residents in Cuyahoga County receive subsidized health care through the Medicaid program, and that is again administered by the Department of Employment and Family Services. I think Joe Garner, who runs that department, has run calculations that the economic impact just of Medicaid is well over $3 billion a year that goes into the local economy as a result of health care coverage provided by the county through the Medicaid program. Going over to the next page, you'll see at the top the Child Support Enforcement Agency. Mary Denahan is our resident expert in the room on child support. We serve families that comprise over 476,000 people. And last year we collected over $240 million in enforcing support obligations. So that is an enormously important income maintenance organization for families and individuals, and particularly children, obviously, in Cuyahoga County. Finally, the Department of Senior and Adult Services, which is our mandated adult protective service organization. You can see that they investigated over 3,000 adult abuse, neglect, and also self-neglect allegations in 2009. They also run the Medicaid program for nursing homes, and as you can see, we have almost 9,000 Medicaid nursing home cases, and then Medicaid waiver cases are cases where people are being served in their homes in order to allow them to stay out of nursing homes. And you'll see the relevant budget information that's associated with each department. The next couple of slides, I'm not even going to try to explain to you what's on there, other than to direct you to them when you have a copy of the PowerPoint in front of you. I was just trying to suggest here the magnitude and the size of the county budget. Particularly, this particular slide shows you, if you could read it, what it would say at the top is those are the revenues generated by the two health and human service levies, and then for a series of years, including 2010, you'll see the amounts that are budgeted for each of the major county systems, as well as the initiatives that we talked about a couple of minutes ago. So I would direct you to those pages if you're interested in particularly how each department is funded. These are just the local dollars that represent their portion of the budget. So this money that is represented on this page is then leveraged by federal and state dollars. The next slide is just a sort of another way to display the same information that was on the previous page. So if after you get out your magnifying glass, after the meeting is over, if you're interested in asking me questions, I'll direct you to Mary Louise Madigan. Now going specifically to the transition work. This is the charge that the Health and Human Services Transition Group, which is co-chaired by John Bagala from the Center for Community Solutions and myself. This is the charge that we were given by the Transition Executive Committee back in February or March. It is the charge that we have now been working on to organize our committees around over the next couple of months, and we'll now talk a little bit about how we've got that organized. If you go over to the next page, you'll see a complicated slide that will attempt to, on one page or in one slide, show you all the work that we're doing between now and September. Going across the top of the slide, you'll see the larger part of the transition committee. Then what our work is done is in the middle, and we've divided our work into three sections or three groups essentially. Close to 300 people signed up to be part of the Health and Human Service transition planning process. They are part of what we call in the middle there the community focus group. We've had, I think, 4 meetings, I believe, of that large community focus group. They've all been at the Visiting Nurses Association. And what we characterize those meetings as initially were Health and Human Services 101 sessions, where we gave the department directors who run all the major health and human service functions of the county the opportunity to brief the community on their departments, the services that they provided, their number of staff, the kind of community partners they have, their outcomes, their metrics, and other kinds of things. So we thought what we needed to do was to get everybody up to the same level of understanding of the county human service departments in order to begin the transition work. The work of that community focus group will then come back into play as we get closer to the end of the transition process. You'll see on the left side we have a funders focus group, and on the right hand a providers focus group. And a few pages down you will see the names of all the folks who have agreed to serve on those committees. The funders focus group is being chaired by William Denahan from the Adams Board and Denise Zeman from the St. Luke's Foundation. That is a group of both private and public funders, including the philanthropic organizations, as well as the state of Ohio and county agencies, who will focus on attempting to align the agendas, the funding agendas for the private philanthropies, United Way, the state, and the county in terms of initiatives going forward. We don't expect that necessarily all the decisions that will get made in that funders group will lead to a perfect overlap of funding priorities amongst all those organizations, but we thought it was important for the County Health and Human Services Department, as it looks forward to its transition, to make sure that we're communicating what are our priorities so that the other major funders in the community can assimilate those priorities into their planning, and similarly share with us their priorities, and so that we can brief the new government as they come in January on the combination of those two sets of priorities. The providers focus group, which is on the right, is co-chaired by Mario Tanti from Beachbrook, which is a child welfare private nonprofit, and Deb Forkas, who runs the Department of Children and Family Services. Although we have two child welfare experts co-chairing that, it is not just a child welfare provider focus group. It is designed to invite in all manner of providers of services who currently contract with the county. That would be child care services, child welfare services, employment and training services, senior and adult senior services, really the full gamut of services that we purchase from providers in the community. They are mostly nonprofit providers. That group is going to both examine sort of the processes that we use at the county to see what suggestions outside providers might have to improve our processes, from our procurement process to our requests for proposals, to our contracting, to our contract payments process. They will also attempt to address recognizing that there are a large number of different types of providers in the room, various programmatic priorities that folks believe that the departments should have. So the work of those two focus groups will start in the month of June and will go through the middle of July, and then we will take their recommendations back to the community focus group in August. I'm going to skip over the next couple of pages because that's simply a listing of all the folks who have agreed to serve on the various work group members, but I'm going to go to the page, and I apologize, Adam, for not paginating these. There's a slide called the work group members. I think it may be a little bit further. There we go. The work group is, for lack of a better term, essentially the executive committee for our Health and Human Service transition planning process. And I will say that membership in the context of at least our group, and I assume this may be true with the others, is a sort of a porous concept in the sense that anybody, since these are all public meetings, anybody who comes to our work group meeting, we consider a member. We give them the same materials that we're sharing with the folks whose names you see on the screen. These are the folks who have agreed to be part of essentially the brain trust that will take the first set of recommendations that come out of the provider and funders focus groups and synthesize them in anticipation of then taking it to the larger community focus group for final sign-off. This group has met probably 5 or 6 times, particularly over the month of May. We met 3 times and actually had a session last week with Russ Pry, who is the Summit County executive. And as many people in the room may know, Summit County is the only county currently that has an elected county executive. So it was really instructive to hear from Russ about, and some of his colleagues in the health and human service world in Summit County, about how they're organized, how they align priorities, and the kind of, I guess what I would say, this is my characterization of it, the enlightened leadership of Russ Pry, who is not a human services person by any means, but who is very much championed the human services agenda in Summit County. So the work group is essentially going to be the group of folks, along with other people who've come to these meetings, who will vet the recommendations that come out of our two smaller focus groups. I'm now going to skip over a couple more pages, Adam, and go to the page, I think the second to last page is called the June to September timeline. And I just wanted to walk, for the balance of my comments, just walk you through where we are in this process. As you can see, in the month of June, the funders and the providers will meet probably 3 or 4 times to align or to come up with and then align their recommendations. We are also doing something which I think may be of interest, and actually Mary Denhan is helping us with this. We thought that it would be useful to do a series of community forums in the county council districts across the county in the month of June. And so each member of our main work group agreed to facilitate a meeting in a county council district in the month of June. We have about 35 members on that committee, and so we hope to be able to do 3 meetings in each council district across the county, 33 meetings with a similar agenda where we take people's ideas, we explain to them essentially what's going on with transition, and we elicit their ideas, particularly on human services. I will say, maybe as an aside, as we've started the process and had the meetings that have been depicted up on the screen, I think we've seen a lot of what you would call the usual suspects, and to some degree, folks who have already been engaged as advocates or service providers or interested folks in human services. We haven't seen, to the degree that perhaps we expected to at the beginning, an influx of regular folks who are supportive of and concerned about human services but haven't really been engaged with the human services world. So we're hoping through these county council district forums in the month of June that we might reach out to folks perhaps more successfully than we have thus far. We're going out, as Randy was talking about, the Public Engagement Committee is doing. We're going to go out to folks and hopefully invite them in. So we're looking to have meetings in libraries and churches and city halls and community centers across the county. These will be advertised on the website, and we hope to be able to reach out to each individual community. As you know from looking at the map that I think is in the back of the county council districts, some of the districts are quite compact, the ones in the central city and the inner ring suburbs, but when you get to those particularly two large districts on the east and on the west side of the county, they are large districts that comprise a great number of communities, and so we want to make sure that we try to regionalize our community forums throughout those districts. So please, if you're interested in attending them, please check the transition website. We should have the full schedule up, I hope, by the middle of next week, and we're starting the meetings probably the end of next week. Our anticipated schedule for July is to hear both the funders and the providers group come back and report out to all of us with their recommendations. We will also get we've standardized a feedback form for use in these county council district focus groups, so we want to hear what comments we get back from those. And then we intend to have a couple of work group meetings to work on those recommendations. Essentially, we'll use the month of August for massaging the recommendations that come out of the two committees, getting the main work group to sign off on them, and then taking them back to a large community focus group meeting for their input and suggestions and edits to the recommendations. And then I believe at the beginning of September, we are required to turn over our recommendations to the Transition Executive Committee. I realize I haven't talked a great deal about substance necessarily in this in terms of what are in the recommendations, and that's frankly because the recommendations aren't done yet. I mean, I think as you saw in if I can go back, Adam, to our charge, which is probably the 6th or 7th, there we go. You can see that it's a fairly broad charge, and I don't think if we had 3.5 years and 3 times as many people that we could necessarily get to every piece of this charge. And so what we are trying to do is to get a sense from the folks who've been engaged with us what they think are the most important priorities, and whether those priorities are programmatic, organizational, budgetary, personnel, approach. I think we'll find as we go through this process that probably our final set of recommendations are going to be, and I don't mean this in any way derisively, a little bit of a hodgepodge, because I think they're going to come from organizations and individuals that have specific interest in pieces of the county human services world, and I'm not sure that thematically they can all be connected maybe as neatly as we would like, but our job, John's and mine, and our colleagues who are working on this, is to try to take the work that's done in each of these committees and then finally what's approved by the community focus group and put them in a package that will be useful to not only the candidates during the general election campaign for county executive and county council, but also then for the new incoming government as they plan their transition during the month of November and December and as they take office in January. So I think, Randy, that is the substance of my presentation, and I would be happy to answer any questions that you have. I appreciate your interest in this. There is at the back, obviously, the county charter website, as well as, I guess, thanks probably to Mary Dennehan, we're on Facebook, like she put CISA a few months ago. But I will also be happy to, if people want to talk afterwards, I have business cards if you want to get in touch with me.
Thank you, Rick. I think the next slide. Yes, so we're at the point where we'll move into public comment. And these are just a few ground rules that we'd like to quickly review with the audience. We ask that you do state your name before commenting so that we know who you are. We ask for a 2-minute limit per person to ensure that we can at least make the rounds of those that want to speak. Everyone, we ask, speak once allow everyone to speak once before you come back for a second turn, I should say. We want you to focus your comments or your questions on, that should say public engagement or the public service, human services work group. And then watch the timekeeper, Dr. Brutney here will let you know if you're at the 2-minute mark, and we would ask that you wrap your comments up at that point. So with that, why don't we open it up? I think you can, don't all jump at once, but I know if no one else, Alicia has a question, but we would ask you to just come down to the microphone. If you could turn the microphone towards the aisle a bit, that would be great. And if you have questions that you want to write on cards, Jonathan walking down the aisle with the red shirt there would be happy to take those, and we can read those from the podium. So, Alicia, welcome.
Thank you. Well, my name is Alicia Washington, and my question was related to the organizational chart for the current Health and Human Services function, where it lists all the different offices, but in the Health and Human Services chart, it only mentions only several of those offices that will be impacted by this transition work. So I was just wondering why the other groups were not included or what the reasoning was for that.
Can everybody hear me? Is that still on? Okay. Alicia, that's a good question. The question was why are the provisions in the charge less inclusive or not as inclusive of all the organizations? I think that's in part probably because we didn't communicate to the Transition Executive Committee sort of everything that was a part of the Office of Health and Human Services. I mean, the mandated organizations are the ones that the state recognizes as being part of the County Department of Job and Family Services. All the rest of those organizations that are part of the Office of Health and Human Services that Mary Louise Madigan and I are in are, again, the more discretionary choices that the commissioners and the community have made in establishing priorities that the county is trying to address. I guess, Alicia, to answer your question, we take our charge as looking at all of the Health and Human Services departments, offices, or initiatives that are part of the county. So the fact that they aren't specifically referenced in the charge will not stop us from looking at the what they do and trying to harmonize that with the work that that the major departments do as well. So it's not as if because early childhood is as an example is in one of those smaller offices that isn't referenced in the charge, we'll pay just as much attention, I think, to early childhood as we will to public assistance as an example. Did that get at your question? Thank you very much.
Thank you, Alicia. I bet Mr. Rosenberger has a question, if no one else does.
I sort of feel like Spalding Gray, if anybody ever saw Swimming to Cambodia, may he rest in peace. But I'm not going to give this chair up. I really like it up here, so go ahead.
Well, thank you for the presentation. It was most educational. I had what I think are easy questions, and I'll ask maybe the easiest. If you could use one word to describe what you would want to see in the new county government as a result of your efforts, what would be that word? And I'll let you think about that, and then I'll get more specific. You talked about the recommendations and how they might be coming from all directions. Can you give an example of a recommendation that might be made? And lastly, if you were the sole individual in charge, what one recommendation would you make?
Did you get all that?
Well, now I'm not so sure I want to be sitting here. I guess the one word I would say, and I don't mean this in a status quo manner, but maybe it'll be heard in that way, is consistency. I mean, I think one of the things that has marked the provision of human services at the county over many, many years has been, to the greatest extent possible, a consistent application of the principles both that we're required to use, that is from the state and the feds that require us to use, as well as what I think are sort of the local spin or gloss on those mandates that come to us from the state and the feds. I think it would, a lot of families and individuals, and a lot of vulnerable families and individuals rely on the county for services. And however imperfect we may occasionally be, and there's many times that we are, they do rely on those services. And I think it would be very disconcerting, if not dangerous, to many of the customers or consumers that rely on us for service if we were to radically change immediately what we're doing. I don't say that to say that we shouldn't look at new ideas. I'm hoping that the process will yield new ideas, but I just think those new ideas have to be implemented thoughtfully and in a measured fashion so that we don't upset a lot of families and individuals that rely on us for service. I think your second question was an example of the kind of recommendation that might come out of the process. I mean, I think it could range very much from, we think that the emerging priorities should be a greater focus on early childhood or reentry kinds of issues or funding issues. I mean, it could be sort of that maybe that's specific. I think it could also be organizational. I mean, the way that we are structured, I mean, I know I talked about those 4 agencies as if they were, written in a constitution somewhere. They're not. Those functions that they provide or that the services that they provide are in fact mandated. The structure is not. And I think one of the things that we've bandied about in the discussions is how specific do we want to be in terms of making recommendations on structure. I mean, there's nothing that says it has to be structured organizationally the way it is. And I think one of the useful, and maybe this is leading into then to the third part of your question, I would like a fresh look, just as one person at the county who's worked in this current structure for a few years now. I love a real look at the way that we're structured and to try to determine, particularly in a less resourced environment like we are now, both in terms of dollars and personnel, human resources, how we can look at ways to be more efficient. I think in certain of our departments, and I think in particular, I'm thinking of Joe Gauntner in the Department of Employment and Family Services. Joe has been a leader at the state level and even at the federal level to some degree to get the state and the feds to loosen up some of their requirements for us that drag a family into our one of our neighborhood family service centers twice or three times a year to be re-qualified for re-eligibilized for their services. Joe has really been on the vanguard of pushing the state to allow us to do many more things by phone, many more things by the mail, and many more things, surprise, surprise, by email and electronic communication. So I think I'm hoping that one of the recommendations that will come out of this, or at least a charge, perhaps, if you will, to the new government will be to look at the structure and see if there aren't ways to use technology more appropriately to service clients. But at the end of the day, a certain portion of what we do is direct social service provision, whether that's social work in the child welfare context, social work in the adult protective service standpoint. We'll never and should never make that electronic or anything other than direct service, but I do think there are some ways for us to learn about how to deliver our services more efficiently.
Thank you for the excellent answer and also the awesome responsibility that you have.
Well, on behalf of lots of my colleagues, I will accept the thanks. I appreciate your comments.
Other questions? Keep in mind, you can write those on a card, and I'd be happy to read them on your behalf. I did have one question. As you talked about, Rick, I was struck by the one slide that kind of showed the very large budgets for children and family services, and you talked about the number of people per year that are taken into custody, or the number of people that may have issues, or the spend around what's Mary's department? Child support. I'm curious to know, how have we traditionally budgeted for that? I mean, as an example, you said I think 19,000 kids were taken into custody. Obviously, there's a correlation between the number of kids that you're serving and the budget. And you can't really predict it, I would guess, because in a perfect world, every year we'd like to see those numbers go down, but that's not the reality. So especially in light of the fact that we're hopeful that this process will help us to save dollars that would then be reinvested into economic development initiatives. I'm just curious, I guess this may be a two-part question, but how do we do it now? And do you see that making the whole effort of carving dollars out for economic development even more difficult, because you can't necessarily predict? And maybe Mary can speak to this as well as one of our leaders in child enforcement.
Well, let me, while Mary's collecting her thoughts, let me take a quick shot. I mean, on the budget process, I mean, it is a very imperfect exercise that we go through every year. I will say, because we've been doing it for seemingly hundreds of years now, we get a little bit better probably every year at predicting. The wild card probably in our budget every year are the child serving agencies. That's mainly the Department of Children and Family Services, although actually the juvenile court, that's also a partner of ours, not obviously controlled by the county commissioners, also provides a lot of services that look, much like the child welfare services that DCFS provides. I think it's always hard to know where you will be at the end of the year or the beginning of the next year on that budget. As an example, back in the late 90s, we had many more kids. I think we had 7,000 kids in custody, is my recollection back from that time frame. And the commissioner's mandate to DCFS was, where it is safe and appropriate, it is much better to have a child with their family, or if they can't be with their family, in the community where they came from, than in custody of the county. And so over a whole series of directors of DCFS, from Judith Goodhand to Bill Denahan to Jim McCafferty, now to Deb Forkas, there's been a great emphasis on reunifying kids where that's appropriate and where it's safe, and also trying to make sure that we were partnering better with the community. Karen Oles, who's in the audience, works in our Tapestry System of Care office, and their job is essentially to marry community-based services to clinical services, to try to provide services in a way that address the needs of a kid and family, but don't require us always to take the kid out of his or her environment and put them in foster care or some kind of deeper care environment. But I will say, if you have a societal issue like I think, I remember hearing from Jim McCaffrey, I think Bill Denahan, you know, the crack epidemic in the 1990s caused a significant number of kids to come into custody, into the child welfare system. More recently, I think actually the economic, although we don't take kids because their parents don't have resources, there has to be abuse and neglect. I think the stress on families with the economic situation being that what it is, we've seen probably more kids referred to the Child Welfare Agency. Whether that has resulted in us taking custody is another matter. To the question on economic, so budgeting is more of an art than a science, I would say. But I got to say that we have some pretty experienced artists at the county who have done this for many, many years, and so their ability to sort of predict what resources, particularly the child welfare system, will need are pretty good. And there's always, as there will be, I think, in the new government, there's always a tussle between the county administration, the part of the county I work in, and the departments to say, okay, you think you need this much money, why do you need this much money? What are the performance outcomes that you're working against, and how have you achieved them? But again, in areas that are very crucial for the life and safety of kids and seniors, we don't cut the budget. We don't make the decision not to serve kids or seniors who need those services simply to cut the budget. On the economic development side, I mean, the one thing that I want to make sure that we communicate is, I think we view much of what Human Services does as economic development. I mean, it may not be the kind of economic development that necessarily lures a business to Cuyahoga County or helps a business that's here, that is already here, expand, but I think the investments that the county commissioners have made over the years in early childhood, in our child welfare system, in our public assistance system, the goal is to create families and individuals who have the ability to participate in society in a way that we all like to participate in, meaning earning our own living, taking care of our families, taking care of our kids, taking care of our seniors. And so I think that we believe that the $640 million, $650 million of human services money is in many respects an economic development investment, an economic investment in the community, and many of the organizations that we work with, in fact, many of the folks who are involved with the transition process represent agencies that are quite large now and in fact have a significant economic impact on their communities. I guess the other piece is, and I think we have to think very carefully about this, and the new government will have to think carefully about this, the $240 million of local dollars that are generated by the levies are designed and are required by the state to be used for human services. So it's not as if we cut the budget by 10% in human services and there's $24 million available, that can't necessarily go to lure a new business to Glenville or to Westlake or to Solon. But I think we hope that if we can help to address issues that can be reached by the human services budget, that will free up other dollars within the county to be used for economic development. So I guess it's maybe a two-step process or sort of a bank shot to get to the use of human service dollars for economic development. All right, Mary, I talked for at least 10 minutes, so you probably have something to say.
What I'd like to add to that is that in those human service dollars, it's not just levy funds. For example, most of the human service agencies get funding from the federal government, and then there is, for example, child support, we get 66% of our funding from the federal government, and then the state matches it at another 33%. And up until this year, child support has not received any of the human service levy fund dollars. And again, I did want to reiterate what Rick said, because if we do a savings at child support, the money that we get, we go ahead and then put into another program. Or we roll it over into the next year. We can't just go ahead and say we've saved $5 million this year and we can go ahead and let it be used somewhere else. So I think that's an important thing. Really, the discretionary dollars that the new government is going to have is going to be in the general fund dollars. And even there, that's a rather small pool when you consider the over $1 billion that the county does have at their fingertips. So it's going to be a challenge for the new government, not in terms of human services, because I believe that we have been able to, the community is very generous, and they pass our levies, and that gives us the money to operate in addition to the federal and state funding that we received and the grant money. But on the other side of the coin, they're going to have to look at those general fund dollars and how do they allocate out of this pool all for this new economic development that they want to create. So that is going to be a transition challenge, and that's one that I think that is going to be a surprise to them, because I think a lot of people just think you have over a $1 billion budget, you should be able to find the money. No, a lot of these funds are already dedicated. So.
And if I could just add one other thing, on the second of the two financial charts that are in the packet, if you sort of just do a ballpark number, $240 million of health and human service levy dollars are generated on an annual basis, and by just a quick calculation, $90 million goes to organizations that aren't under the control of the county commissioners. So $40 million goes to Metro Health Medical, $35 million goes to the Combined Behavioral Health Board, and another $15 million goes to the juvenile court. So there's a significant portion of what we all think when we're voting for the levy, and we're right, that these are dollars that are going to serve kids and families and seniors, but they're not always being served by the county government that is actually imposing the tax levy. And so it's important for voters and for the new government to recognize that, without without that $40 million that Metro Health gets, or the $35 million that the Behavioral Health Board gets, although that is not their entire budget, that is probably the most flexible set of dollars that those organizations have, and that allows them to continue their efforts in the community.
Good point. Well, other questions, comments?
I'm going to pull on my ear like, when my kids watch this on YouTube, I want to make sure that they know, who was it?
All right, we have
Oh, there we go.
a brave soul coming. Thank you, sir.
Quick comment or something. I don't know if this is my name is Joe Miller, and I don't know if there's a comment, a question, or what, but just throw a few things out real quick here. Just looking at the statistics here, I think that's, I commend you for the work you have. You have a huge task here, but looking at these numbers is just frightening. To look at the amount of, I don't remember the acronyms, but the welfare cases, 135,000 or something. I don't know if that's right, the right one, but you got 275,000 health care coverage. You got 476,000 people there, I think, on food stamps. Is that right?
That's actually who are served through the Child Support Enforcement Agency, through the enforcement of child support obligations.
Okay, so I guess, and then a budget of $650 million. So I guess I got a couple of questions. One would be, if we compared our county to some of the other counties, the percent, if this $650 million is probably what, at least 45% of the budget? Is that comparable to the other, not just Ohio,
Yeah.
but some of the other states and stuff? Is that pretty comparable?
I guess the apples to apples comparison for us would be to Franklin County, where Columbus is, or Hamilton County, where Cincinnati is. And I haven't looked at those percentages recently. I would say we're probably within the ballpark. We're probably within a relative small deviation from where they are in terms of the budget. I will say, I think that we've gotten much publicity over the last 4 or 5 years as being one of the poorest cities in America. So I think part of the numbers that you see there, and part of the cost then of providing the services, are driven by the fact that we have more poor families and poor individuals in Cuyahoga County than may exist in other places. But if you looked at us compared to Detroit or Pittsburgh or Indianapolis, I wouldn't be surprised. I haven't looked recently, but I wouldn't be surprised that we aren't pretty close to their same proportion.
Right. Probably. Well, I've heard that saying that says at least we're not Detroit, so, but we're close, I think. I think we're close. But I got one question then for anyone, is do we have a solution to this, or is this, again, I commend you for the work you're doing, but is the health and humans, the budget just going to continue to grow? Do we have any kind of a way to stop the bleeding? Are we looking at job creation, job growth, and within the budget to increase with the transition? It may not be a question for you, but I'm just.
Well, while Randy's thinking up his answer to that question, I mean, from the Human Services perspective, I think we have heard loud and clear from the commissioners who've told, if we had had our way, with the levy that was just on the ballot, from a pure need standpoint and a pure provision of human services, we would have asked for, as staff, we would have said, we think we need more money in order to serve the greatly increased number of families and individuals that have been coming in for service. As a result, primarily, I think, of the economic downturn that the community's experienced. The commissioners said to us, we are not going to raise taxes in this environment. And I can, as a homeowner who pays property taxes in Cuyahoga County, I can completely understand that. So we have been told essentially that we're on a budget that will not be increasing. We've also seen, and part of the demand on the local levy dollars has been caused by a diminished investment by the feds and the state in us. Now, we've been fortunate, and many of you have read stories about the state budget being essentially balanced the last couple of years by federal stimulus dollars that have come in. The same thing is a little bit true on our side. It's nowhere near the same proportions, but in an unusual way, we've actually seen some investments in a couple of different areas that have been pass-through dollars that have come to us from the feds and the state as a result of the stimulus dollars. But we are very much aware of the cost of providing services, and I think that we have tried to demonstrate as best we can accountability on the fiscal side. But I mean, we are delivering probably more services right now than we ever have before with fewer people and at budgets that have either stayed the same or gone down. I know that doesn't necessarily feel that way when you pay your property tax twice a year to the county, but we recognize, or if we didn't recognize, the commissioners told us to recognize the fact that we weren't in a position for lots of reasons, including the other controversies that swirl around the county right now. This was not the time to be asking homeowners to increase their investment in the county. And so we are trying to the greatest extent possible, live within our means. And I think so far we've been successful in that.
I would just add that this is a work in progress. The reason we have the 12 committees or so is that we do want to try to figure out just what you outlined, sir. How can we find additional dollars to invest in economic development, but at the same time, we have to be smart to ensure that we don't throw the baby out with the bathwater. We can't leave so many of our citizens so vulnerable that, in essence, we're making the problem even worse by abandoning people that will come back to us in some way, having more mental challenges or more economic, challenges, whatever the case may be. So it is a balance, and I think it's exciting that, we have over 1,100 volunteers working on all these committees trying to help really figure this all out. The other point I'll say about economic development that I'm excited about as it relates to this process is the Economic Development Committee realized that economic development is oftentimes defined differently. It means different things to different people. Oftentimes in this community, in this region, many of us are enamored with economic development, as I refer to it as with a large E, meaning, the big buildings, the shiny new buildings, the new casino, the new medical mart, business attraction kinds of things. And several people realize that while that's important and that's nice, economic development for a lot of the people that we just talked about, the disenfranchised, the people that are kind of down on their luck, is all about job creation. It's about helping them to keep their homes. It's about education. It's about a lot of those other things. So we have kind of spun off the Economic Development Committee, a separate committee that we're calling Quality of Places Committee, really looking at the quality of the place. What do we need to do for everyday citizens to ensure that they get a leg up and get the assistance that they need to be a part of any economic development efforts, job creation efforts, et cetera. And of course, with more tax-paying citizens, the likelihood of our county performing better and generating more tax dollars goes up, and it's good for all of us. So that too will take some time and some ongoing work, but at least we're thinking about it the right way in my estimation, and we're hopeful that we'll get some good recommendations coming back from those committees. Other questions, comments? Jonathan, I assume you did not receive any cards? Okay. Do you really want this to end? I mean,
It's only 80 degrees outside and sunny, and
That's
there's
right.
still an hour worth of sunshine left.
it's only the third sunny day of this year.
Right, exactly.
Well, why don't we, Adam, go to the next slide here, and we can move right into wrap-up. We do want you to know that we will take the information back, the recommendations, the feedback, to our work groups and continue to refine what we do. We will continue to post our forums. I think half of the website will be your June meetings, Rick, with all, with all the work that you'll do throughout the county. We really would ask you to take the time before you leave to complete the feedback forms. It's real quick. I promise you within 60 seconds you can have that feedback form done. There are boxes right in the back that you can drop those in as you exit right at the door. So please take a minute to do that. It's very helpful to us. You can always visit charter at cuyahogacounty.us. It's a very, very well done website. And I'm not just saying that because Adam's here, who's one of the architects, but it really is. Anything you want to learn about upcoming meetings, you can download the charter, you can download all sorts of helpful information. And the last bullet there says that your ongoing engagement is critical. We would ask you to continue to watch that website because you will see additional forums and additional meetings and opportunities for you to become more engaged in the process, to learn more about what we're doing. As I talked about with public engagement, there's a few more forums that will be scheduled that aren't scheduled yet, so the only way you'll find out about that might be the actual website. I don't know if there's another slide after this one, Adam, that might talk about, no, but I was just going to mention we also are doing the Facebook and Twitter and any social media that we can think of. I would ask you on behalf of our outreach subcommittee that if any of you have ideas about constituency groups, clubs, associations, fraternities, whatever the case may be, that we might reach out to as we conduct these forums, please let us know because we do want everyone to feel a part of this and to participate in the process. So, most of the folks here are involved in some way, but certainly you can let me know. Andrew's standing at the back there with the blue shirt on. You can let him know. Dr. Brutney here. Lorna in the pink top here. Mary in the white sweater here. I mean, there's, many committee members here. So let us know. And thank you so much for taking the time to come out on a beautiful, sunny evening to hear more about this process. I also want to say thank you to Regina High School for opening up the venue for us, and it's really been wonderful. So if there aren't any other housekeeping items that anyone can remind me of?
Bueller, anyone?
Bueller. Great. Just make sure you turn in the surveys, and thank you. Have a good night. See you next time.